My name is Donna Harris, and I was a part of Group 3 along with Carmina Ozeda, Sherilyn Strayer, and Leslie Frame. The intervention or management that we chose to research for our capstone project is melodic intonation therapy, also known as MIT. This was developed by Nancy Helm Estabrook, Marjorie Nicholas, and Alyssa Morgan. Now, before we get into the administration of this intervention, I would first like to discuss some background information, beginning with the history of MIT. Now, for centuries, researchers have known that patients who have severe aphasia or individuals with severe aphasia are able to sing perfectly. They're able to sing popular songs or rhotic tunes with little to no errors. However, when speaking, articulation is an area of great difficulty for them. And this is supported by Norton et al. In 2009. Now, in 1904, a researcher by the name of Mills suggested that clinicians try playing the piano and singing popular songs with clients in hopes that it would affect or improve their articulation when speaking. However, the results of that study show that there was little to no effect on propositional or conversational speech. However, from that study, clinicians did suggest that maybe words and phrases should be presented in more rhythmically rather than singing. And with that idea in mind, in 1973, a formal study of this approach was formed. Albert, Sparks, and Helm began to explore the effect of singing with severely impaired individuals with aphasia with stimulating propositional speech. That hypothesis led to this form of therapy. Now, you're probably asking yourself, what is MIT? Well, MIT is a hierarchically structured program that is divided into 3 linguistic levels: elementary, intermediate, and advanced. Multisyllabic words and short, high-probability phrases are intoned musically while tapping out syllable by syllable within the first 2 levels. The 3rd level introduces longer and more phonologically complex sentences or phrases. These phrases are first intoned, then they're produced with exaggerated speech prosody, and finally they're spoken normally. The clinician taps the patient's left hand for each syllable of all intoned phrases, and this helps to stimulate the right side of the brain. Items are intoned slowly with continuous voicing using simple high note to low note patterns. Pictures are also used to illustrate target items and are helpful in stimulating the patient's response. Now, I was lucky enough in my undergrad to actually observe one of these sessions take place in the clinic. I was in the observation room next to the client's wife, and the client's wife was telling me that she had not heard her husband speak in a very long time, besides the one-word utterance that he had in his repertoire. However, after some sessions at MIT, after he got to the final stage, or stage 3, once he finished exaggerated speech prosody, he actually was able to speak normally, speak one phrase normally. And that was a great feat for him. And his wife got very emotional about it because it was the first time she heard her husband complete a phrase in years. Now, what is a great target population for MIT, or who is a good candidate? Well, for one, patients who've had a stroke, or those who are non-fluent or have severely restricted verbal output that is at least partially suppressed when singing popular songs. They have to have relatively good auditory comprehension. They have to have poor repetition, even if it's just repeating single words. And they're also looking for poor articulatory agility, as established by a rating of 3 or less on the BDAE, which is the Boston Diagnostic Aphasia Exam. And then lastly, they're looking for a patient with good emotional stability, motivation, and a good attention span to attend during all tasks. That is my portion of the MIT presentation. I was very glad working with my team, and I was glad to have the opportunity to research such a therapy, and I do hope to use it in my future. Thank you.